Lorazepam is one of the benzodiazepines that is used to treat anxiety disorders. It is well known by its brand name Ativan, and it can also be used to induce sleep in people. Lorazepam is having few advantages. It has rapid onset of action when it is given by intravenous route. Therefore, it can be used as a drug of choice in the people to induce sedation and anxiety. It can also be used in a variety of other conditions. It can be used to control anxiety-related insomnia. Another advantage is that lorazepam can be used as a pre-anesthetic medication to relieve anxiety as well as to induce sedation. During anesthesia, the patient should be calm and not anxious. Lorazepam helps in this condition. It can also be used to induce amnesia in people before the anesthesia. It is called anterograde amnesia. It is a loss of memory of current events. Lorazepam can induce this condition, which is helpful during surgery. This medication is a first-line agent for the treatment of status epilepticus. Apart from these clinical uses, it can also be used to reduce anxiety in people with agitation. As an off-label, lorazepam can also be used to control chemotherapy-induced nausea and vomiting. So it is having so many types of clinical uses. This medication is available as tablets as well as capsules for oral administration. Even it is also available as oral solution. This medication has high bioavailability and it shows the duration of action around 8 hours. So these are the various advantages of lorazepam which makes this medication widely used to treat anxiety and insomnia. So today in this video we are going to discuss the important key facts about this medication. Now let's see how this lorazepam acts. Lorazepam is a benzodiazepine. Benzodiazepines can be identified by their suffix azepam. We have so many types of drugs like clonazepam, temazepam, diazepam, oxazepam and many more. All these medications end with the suffix azepam, which indicates they are benzodiazepines. Benzodiazepines work on the brain to increase the action of GABA, gamma-aminobutyric acid. Anxiety is a condition of increased neuronal excitation that may result in the activation of few excitatory neurons. Many of the anxiolytics can produce their action by either reducing the excitation or increasing the inhibition. Among the inhibitory neurotransmitters, GABA is one of the important amino acid neurotransmitter. GABA can act on its receptors like GABA A as well as GABA B. Control of anxiety is linked with GABA A receptors. They are inotropic receptors that show an inhibitory response. When GABA binds to these GABA receptors, they open inward-going chloride channels. This allows chloride to enter into the membrane, which produces hyperpolarization. Lorazepam can increase the action of GABA by activating these GABA A receptors. It is not a GABA agonist and it is not directly binding to the same site where GABA is going to bind. Instead, it can act on another site called benzodiazepine binding site on the GABA A receptors. On this site, lorazepam can bind, which facilitates the increased binding of GABA to the GABA A receptors. This results in the opening of chloride channels so that chloride ions can more easily enter into the membrane, which results in the increased hyperpolarization. This produces an enhanced inhibitory response that can control the symptoms of anxiety as well as convulsions. When to avoid this medication? Lorazepam is not recommended in the people with acute narrow angle glaucoma. This medication is not suitable for intra-arterial administration. In people with severe respiratory depression, lorazepam is contraindicated. Sleep apnea may be associated with bronchoconstriction and difficulty breathing. In such people, use of lorazepam is contraindicated. Lorazepam should not be stopped suddenly as it may result in withdrawal effects. Therefore, reduce the dosage gradually to avoid withdrawal effects. In a few people, lorazepam can produce increased aggression and hyperactivity. Such types of effects are called paradoxical effects, which are commonly observed in children. So, in presence of a significant paradoxical effects, lorazepam may be contraindicated. Central depression. Lorazepam can produce central depression. Therefore, it should be carefully given with other medications that again produce central depression. Particularly, opiates can produce severe sedation and respiratory depression. Therefore, when this lorazepam is given with opiates, it can produce significant sedation and respiratory depression. That's why, along with benzodiazepines, the use of opiates is not recommended. Alcohol can also increase the sedative effects produced by benzodiazepines. So, consumption of high amounts of alcohol can produce significant sedation. Consumption of alcohol-based beverages while taking lorazepam may also enhance sedative effects. Lorazepam can reduce the alertness. Therefore, it can impair the daily performances like operating the machinery or driving the vehicles. Even though lorazepam shows less dependence compared with opiates, on prolonged use, it may lead to some physical and psychological dependence. Particularly, this dependence can be observed in people with a history of alcohol or drug abuse. That's why it should be used for a short-term treatment which reduces the risk of dependence. Lorazepam should be given carefully to the people with breathing disorders like asthma or COPD, chronic obstructive pulmonary disease. It can also increase the risk of sleep apnea, so the people with a previous history of any such conditions should be carefully monitored. Now let's see the side effects of lorazepam. The main side effect is the drowsiness and dizziness produced by this medication. It can also produce fatigue, amnesia, disorientation, vertigo, and double vision as few important side effects. Other side effects like confusion, restlessness, and excitement can also be observed. How to take this medication? Lorazepam is available as immediate release tablets as well as extended release capsules. For the treatment of anxiety disorders, it is available at different strengths starting from 0.5 mg to 2 mg. In the case of extended release capsules, it is available from 1 mg to 3 mg. For the treatment of anxiety disorders, it can be initially started at 2 to 3 mg given in divided doses. The effectiveness of lorazepam is not established beyond 4 months. Therefore, this medication is only used for short-term treatment of anxiety. The target dose for the treatment of anxiety disorders is variable from 2 to 6 mg per day, which is given as divided doses. Extended release capsules contain medication which is equal to the total daily dose of lorazepam that is derived from immediate release tablets. Therefore, for the treatment of anxiety, they can be used as one capsule per day. For treating insomnia, immediate release tablets can be given as a single dose of 2 to 4 mg at bedtime. However, in the elders, because of more sedative effects, the dose may be reduced to around 1 to 2 mg given at bedtime. So that's all about this medication lorazepam, which is a benzodiazepine that is widely used because of a number of clinical indications. This medication can be used in the treatment of anxiety disorders as well as it can be used to induce the sleep in people with insomnia. This medication is also used as a first-line agent in the treatment of status epilepticus, and it can also control agitation that is associated with anxiety. Before the anesthesia, this medication can be used to induce amnesia as well as to induce the sedation. As an off-label purpose, lorazepam can also be used to control chemotherapy-induced nausea and vomiting. It has many other advantages like high bioavailability, suitable for oral administration, and available in different dosage forms. However, this medication can have limitations of drowsiness, sedation, and respiratory depression, particularly when it is combined with other CNS depressants. With proper precautions, this medication can be used to control anxiety and other disorders. So that's all about this medication, lorazepam. I hope this video is useful to you. If you really like this video, please subscribe to our channel and hit the like button to support our work. Post your opinions and comments in the comment section below. Thanks for watching. See you in the next video.